Hello, good morning, good afternoon, good night, everyone. Thank you for having me and for inviting me. It is a pleasure to be here with you. So my name is Claudia Toledo. I am the general manager at Elsevier in Brazil. I think that most of you are familiar with Elsevier. It is the largest company in evidence-based information and knowledge in the world. And today we are going to talk about the digital patient journey, which is an evidence-based approach that we brought within the technology to support the providers to improve the healthcare efficiency. And at the end of the day, improve the patient's outcomes. So, when we talk about the technology, we're talking about innovation. Innovation that drives results across the entire chain, and this is what is the digital patient journey. This innovation and this digital patient journey has been improving the quality and patient safety. It has been increasing the physicians and the multidisciplinary team satisfactions. It has been engaging patients in the right care and commit to their results. It has been delivering structured data to provide better management decisions. And it has been improving the cost efficiency in the healthcare institutions. So, when we talk about the digital patient journey, we're talking about several providers. We're talking about patients, we're talking about physicians, we're talking about multidisciplinary teams like nurses, nutritionists, physiotherapists, and we're talking about the families of the patients. So there are several challenges within the patient journey, and it starts with the prevention and early signs. When we see lack of patient commitment, we see patients living with comorbidities, we have lack of reliable and complete patient education. So the patient goes to WhatsApp and Google to find out whatever they can use for them to commit with the prevention for a better healthcare, wellness. And we see patients looking for inappropriate services. So they go to the wrong place when they need to have a diagnosis. When we're talking about the diagnosis, which is the second phase of the digital patient journey, we see physicians with different backgrounds and experiences. We have seen as well risk of misdiagnosis. So the doctors, the physicians, due to the lack of information of the differential diagnosis, they sometimes define the wrong ICD. Memory fails. Nobody remembers everything all the time. And there is a communication gap between physicians and patients. This is something that physicians complain the most. I don't know how to talk to my patient. When we're talking about the third stage, we're talking about treatment. And the challenge here it is that the clinical teams also have different backgrounds and experience, and they don't work together. They don't communicate in the right way between them. So we have multidisciplinary teams that are not integrated. And this is a strong problem within the healthcare systems overall the world. We have also the challenge of the prescription, the right prescription. So we see lots of under-prescription. We see lots of over-prescriptions. And we see the teams working on them and not putting the patient in the center. The fourth stage, when the patient goes home, what we see is that there's a wellness distraction. We don't have a 24-hour service and communication between the institutions and the patients. So we have gaps of communications after the discharge. And we see, as a result, the decline of the patient's health. So, what is the digital patient journey that Elsevier is approaching, and this is our faith. So, the technology, together with the evidence-based approach, can provide better results and more satisfaction in each stage. So, in the prevention, we believe that the online self-triage can facilitate the patient to engage in the prevention. So the patient can go to an app and do a self-triage within the app. And this is registered and it can be sent to the EHR. So when the doctor receives the patient, he already have a self-triage done by the patient that he can start from. So while we are doing the online self-triage, we can educate the patient with handouts or pieces of information that will impact him in or her in the moment that he or her are more open because the person is not feeling well. And this directs the patient to the appropriate service, avoiding that the patient goes to a place that doesn't is the better for him, her. And then it drives to a teleconsultation, or can be a presential consultation. It doesn't matter, it can be both. But when you are in the moment of the diagnosis, what we believe is that we can provide an accurate clinical decision to the physicians. So in this case, we work with decision trees that starts from the signs and symptoms and goes up to the treatment, and it provides the diagnosis, potential diagnosis, depending on the signs and symptoms, and the differential diagnosis. So the physician can consider all the potential clinical conditions for him to define the right ICD, as well as the treatment decision support. So not only you can go into the exams and the diagnosis, but what is the right treatment for this patient. Everything based in the latest evidence, medical evidence, clinical evidence that we have. And we have it in all-in-one. So all-in-one information that are essential to support the physician at the bedside. So you don't need to go to several apps to calculate, to do clinical calculations, or to check drug interactions, or to check for medications. Or so you have everything in a single place, and this is important to the doctors because this is he needs several things at this moment. And when you go to the treatment, what we believe it is that we need to provide integrated flows. So, which means that prescription should be in a checklist format. So once defined the ICD, it should come within the EHR in a list for the physician just to check. He doesn't need to write. He doesn't need to think too much. He has the options and he can check, or she can check what is the right prescription and then sign. And if you are in the hospital and you are treating inpatient, you need to have integrated multidisciplinary care plans that put the patient in the center of the care. So instead of having nurses care plans or nutrition care plans or different care plans that belongs to the professionals, it comes together into a single one care plan where everyone comes inside and everyone communicates in a better way, registering as well in a checklist format. We turn it is easier to do the right interventions, the right diagnosis, and the right outcomes results that you need to register to the patient to have a better care. And it turns easier. The workflow turns easier because everything is in the right place, in the hands of the professional, healthcare professional, and integrated into the EHR. So it improves the EHR usage satisfaction as well by the clinical teams. And this is not the end. So we have the home care. We have to telemonitor the patient, so in an effective way. So 24/7 communication between the healthcare system and the patient is key to guide the patient and commit the patient within its own care. And by bringing education, engagement, and telemonitoring that includes vital signs that the patient can send to the hospital, we can improve the home care stage and engage better the patient and the families of the patient. So we can send alerts as well to engage the patient in the home care, so we don't allow the patient to distract. So we are remembering what needs to be done. How does it look in the practice? In the practice, the patient goes to an app, his mobile, or in his computer, and he goes to an online self triage, based bringing the signs and symptoms and being educated at this moment with information about what is happening potentially to him, and avoiding the patient to distract with the wrong information that they used to have. So once the patient does the online triage, the information goes to the system, goes to the healthcare system, to the EHR, the technology system that the hospital or clinic has. And the system sends the patients to an online teleconsultation, or to a scheduling that can be done later within a teleconsultation or with a presential face-to-face visit within the doctor, within the physician. At this moment, so we have can be in the face-to-face visit or in a teleconsultation or in a consultation. At this moment, the physician is together with the patient. So in this moment, the physician needs to confirm the diagnosis. He needs to be sure that the diagnosis that he is defining, it is the right one, to avoid misdiagnosis. And it should be based on evidence, decision trees that would guide him in an easy way and confident way to define the right ICD. Here we are in the EHR. So the physician is in front of the EHR, and once defined the ICD, the physician fills the checklist that is related to that ICD and can sign the prescription in the EHR. This checklist, it is not something that limits the physician. It just helps the physician with the sort of medications or exams that are the recommended ones by the best practice to that physician. So he has the options to select. He's open to choose what he thinks that is the best for the patient. And if the patient turns into an inpatient instead of an outpatient, we believe that the multidisciplinary teams needs to work together. So we believe that care plan, an integrated care plan that could be used by all the multidisciplinary professionals in the same place into the EHR in a checklist format accordingly to the ICD will support them to not work in an individual way, but in an integrated way where the patient is in the center of the care and not the healthcare professionals. So finally, when we have the discharge, the patient continues his care at home, and at this moment he needs to be monitored. So we cannot discharge and let them go. So within an app in its own mobile, the patient can communicate with the institution, with the healthcare institution, and be engaged into the care. This is a complete cycle that aims to improve the healthcare results, outcomes, and to add value to the full journey that everyone needs to go several times in the life. So it would improve the professional satisfactions, the patient satisfaction, and the families of the patients. Of course, that if we are talking about health, we are talking about knowledge that changes. So we have an exponential growth of the knowledge, and we keep working with the team that we have to provide continued education and training to support the practice. So we should have, at the same time, an online system that would help and would turn sustainable, keep training and monitoring the level of knowledge of the team. So the tutor should define the content. It can be new, something created by that moment, the challenge that they are facing, or an existing content into a library of courses. So the tutor sets up groups of employees, departments, doesn't matter, and the dates that this is going to happen and the alerts that they are going to receive. The professionals receive the information that it needs to be trained. So they receive in the mobile that they need to do this training with the link. So the professional learn, do a test, and then have a grade, like a score, which allows the tutor to monitor and improves the upcoming courses that the professionals will need to go through in the future. So it should be an online 24/7 platform support. It should be for desktop and mobile devices. It should be working for Android or for iOS, and it needs to be unlimited to tutors and to trainees. So you cannot block that. So this is what we believe that supports the continued capacitation. So what are the potential results of the care coordination that the digital patient journey drives? So in the prevention and early signs, the patients who undergo coordinated care, they reduce 2 times the visits to primary care system. And they reduce 6 times the visits to the specialist. Doesn't matter if it's teleconsultation or just consultation, it reduces. When you're looking for a diagnosis, we know that 60% of the clinical questions that the physicians has, they are not answered. There's a lack of information, limitations of time, access to the information. They are not sure, so we reduce the number of questions not answered that the physicians used to have. In the treatment, we know that the health costs are 75% lower with patients that goes through a coordinated care. And this number of the United States, unfortunately, I don't have this for Latin America and Brazil, but 16% of the Medicare cost was reduced by engaging patients in the self-care and coordinated care. So I hope that you enjoy this presentation, that it can help you to take a different outlook on what we can do in terms of technology and evidence-based information in the practice to improve the patient outcomes, which is the most important thing and the reason why the healthcare systems exist. Thank you so much for having me. Was a pleasure to be here with you, and see you in the next presentation.